Chapter 3, the Dental Healthcare Team. Introduction. The theme is people working together for a common purpose. Dentistry, the purpose of quality oral health care for the people of the community. Dentist is legally responsible for the care of the patient and the supervision of all other members of the team. So the members of the dental healthcare team are considered the dentist, which can be either a general dentist or a specialist. And a specialist means that they specialize in a certain area, like orthodontics, periodontics, endodontics, a pedodontist, which is a pediatric doctor, an oral surgeon, what else? A prosthodontist, okay? The dental assistant, which can be clinical, expanded functions, or a business assistant. They can be trained on the job or they can be formally educated. A dental hygienist and a dental laboratory technician. Keep in mind that not all offices have a dental laboratory technician on site. Sometimes the dentists have to send their stuff out to an actual lab to get any repairs done or anything like crown and bridge work or temporaries done. So the dentist, before going into practice, all dentists must pass a written national board examination. Dentist is required to take a clinical board examination in the state in which he or she chooses to practice. So if they choose to practice, let's say in New York, the board exam that they have to take in New York might be different than the one that they would have to take in Texas or Florida or another state in order to practice. The dentists have a variety of practice options available to them. Most dentists are members of their professional organization, the American Dental Association, which is also known as the ADA. So education and certification of the general dentist. A college degree, so you need a 4-year pre-dental education, 4 years of whatever, business, engineering, etc. An undergraduate dental education, which means the 4 years with emphasis on basic sciences the first 2 years and clinical science the last 2 years. So a passage of a written national examination and a clinical state board examination before permission to practice is granted. The education of the dental specialist, if they're going to go into a specific, if they just don't want to do general dentistry, they want to go into a specific area, they need the same education as a general dentist. They need a master's program in the specialty ranging from 2 to 6 years, depending on the area of specialty. And in some programs, a PhD for another 2 years of education and a postdoctoral education. The ADA recognizes 9 dental specialists. So dental specialists are dental public health, endodontics, which is the specialty of root canals, oral and maxillofacial radiology, which is x-rays, oral and maxillofacial surgery, which is oral surgeon. They can extract teeth, they can do biopsies, they can do reconstruction of certain things, and they do surgery of the jaw also. Oral pathology, which is like when they do when they examine tissues of the mouth for cancer and stuff like that. Orthodontics, which is braces. Pediatric dentistry, which is for children, usually of the age of 1 to 18. Periodontics, which is the specialty of the gums and bones around, because you know the teeth are held up by the bone. And prosthodontics, which is usually removables. They can be either, well, removables, of course, removable, something that you have to take in and out. They can also be fixed, like fixed bridges and crowns. The registered dental hygienist, which is also known as RDH. The dental hygienist, RDH, is a licensed professional with specialized clinical and educational skills. The minimal education required for a dental hygienist is a 2 academic years of college study in an ADA accredited dental hygiene Duties assigned to the dental assistant are determined by the regulations of the Dental Practice Act of the state in which he or she practices. The dental assistant is trained to perform many activities that are not required of the dentist. The educational program for a dental assistant must include didactic, laboratory, and clinical content. The roles of the dental assistant. Clinical dental assistants are directly involved in patient care in the following roles. They do chairside assistant, which means they pass instruments, they mix cement or materials. There can be a circulating assistant, which means you are from station to station. You don't work in a particular area. They can do community work, sterilization assistant, which you're in a lab and you're in charge of just the sterilization, and an expanded functions dental assistant, which is what you will be once you graduate FCC. So community work and mobile dental facilities. Many dentists find the responsibilities of the chairside dental assistant. Primary responsibilities in this role include, but are not limited to, the following. It mixes dental materials, exchanges instruments, provides oral evacuation during dental procedures. And oral evacuation means you hold the suction, the HVE, and this takes the saliva, blood, floating materials out of the mouth for the dentist. And they make the patient comfortable and relaxed. Now, this assistant does not do any type of work inside of the patient's mouth. The circulating assistant serves as an extra pair of hands where needed throughout clinical areas of practice, referred to as six-handed dentistry, in many cases responsible for seating and dismissing patients, preparing and caring for instruments, and treatment rooms. Community work and mobile dental facilities. Many dentists find it personally rewarding to volunteer in the community. Some communities and nonprofit agencies own vans that are fully equipped. These vans are operated and staffed by dentists and dental assistants. And it means that they go by like city to city, and they do sometimes charity work, or they do it on what they call a slide scale, depending on how much money you make. The sterilization assistant efficiently and safely processes all instruments and manages biohazard waste. So they have to make sure the instruments are cleaned properly, they are sterilized properly, that the autoclaves are working or in good condition. The autoclave is the machine that sterilizes the instruments. That the biohazard waste, which means anything that has a lot of blood, teeth, tissue, etc., they're put in these red biohazard bags and they're disposed in a specific container in a specific area of the office. So that has to be the job of the sterilization assistant, to make sure that that everything that needs to be in there is in there, and that properly gets discarded by the company that comes to pick it up. They're also responsible for weekly monitor of sterilizers and maintenance of sterilization monitoring reports. So when you get into the office, you will know what you will see, or you will learn that there are these little tests that you put inside the autoclaves, and you run the autoclave with that little test strip inside. And this will tell you if the autoclave is running the way that it's supposed to, so that you know that your instruments are being sterilized the way that they're supposed to. And these things are done about once a month. Select infection control products. So any chemicals that are used to clean stuff around the office, like the Cavid wipes, or anything that's used to spray the instruments before you clean them or after you clean them. And they perform quality assurance procedures. Now, the expanded functions dental assistant, which is also known as the EFDA, has received additional training like you guys. You're legally permitted to provide certain intraoral, which means inside of the mouth, patient care procedures beyond duties traditionally performed by a dental assistant. Duties vary according to the Dental Practice Act in each state or province, which means what you can do in Florida might not be the same thing that you can do in Georgia or in Texas as an expanded functions dental assistant. Each state regulates what you can and can't do. The business assistant, business assistants, also known as administrative assistants, secretarial assistants, and receptionists, are primarily responsible for the smooth and efficient operation of the business office. So this is one of the questions that you guys had some trouble with in one of the pre-tests. The duties of a business assistant include the following. They're scheduling appointments, they're communicating on the phone, they're coordinating financial arrangements with the patients, and they're handling dental insurance claims. This is not the job of the dentist. This is the job of his front office staff. That's what you guys are there for, front office and office managers. The dental laboratory technician may legally perform only those tasks specified in the written prescription of the dentist. Individuals who wish to become a certified dental technician or a CDT must pass a written examination. Dental technicians may be members of their professional organization, the American Dental Laboratory Technician Association, also known as the ADLTA. The education of the dental laboratory technician is a 2-year educational program. It can be voluntary, is often undertaken. The prospective technician must pass a national examination to earn the credential of CDT. Most laboratory technicians undergo apprenticeship training, which means they don't go to school for it, but they are trained by somebody that is already a technician. Supporting services. The dental supply representative who concerns product. Like if there's anything new in the market, a new toothpaste, a new floss, a new toothbrush, etc. Dental equipment technician is a specialist who installs and provides service for and repairs of the dental equipment. They may be provided under a maintenance contract on an as needed basis, which means they're only called when they're needed. And the dental equipment technicians, they can repair chairs. If your dental chair is not working, they can repair like the overhead light from the chair, the panoramic machine, your x-ray machine, your hand pieces, your high-speed hand pieces when they don't work properly, etc. Legal and ethical implications. Never perform a task beyond your level of training. Avoid illegal tasks and join a professional organization. So never perform something that you have never done before and you are unsure of because it's out of your comfort zone or it's out of something that you've ever done. Because this can, especially if it's inside the patient's mouth, because this can bring you legal action. And here they have massages, soft fleece blankets, a large selection of scented towels after, and I